So the first question that I have is, it seems like with integrative medicine that it's very difficult for doctors not only to make that transition into integrative medicine, but it seems like even once people get the integrative medical clinics up and running, why is it so hard for them to make it? Why do people struggle so much with it?
What do you mean? What do you mean make it?
Make it meaning financially. Make it meaning being successful to where, a lot of people that are reaching out to us are struggling, saying I'm having a hard time making ends meet, or I'm having a hard time getting a lot of patients in the door. Why do you think that is? Is it the model of integrative medicine? Why is it so hard to function and be successful in that model?
So I think in integrative medicine, it's clearly the wave of the future from a practice standpoint as far as what the patients want. It's definitely consumer driven. I think one of the challenges that I've seen and been hearing when I'm having conversations with other integrative medicine practitioners, particularly those who are doing cash-based practices, is that the patients want to be able to use their insurance. So if they're coming in and they are looking for a provider, they may come in and get some initial information from that provider and then go and start working on those changes, but they may not follow up because of the inability to pay for what is being asked of them from a nutritional supplement standpoint, from a lifestyle standpoint, and from follow-up standpoint. So it may be initially that all they're doing is just going, getting a little information and not coming back. So you're not really building a patient base from that. The second component of that is that in order for practices to thrive with lots of different integrative practitioners, they need a large volume of patients to draw from. And if patients aren't coming in for regular visits because they don't have a lot of discretionary income, that makes it a real challenge to have those patients continue to follow up. One of the reasons that we chose to do insurance-based integrative medicine versus just doing cash-based was because we knew that we would be able to reach a larger audience. I mean, clearly, patients who are coming to see cash-based practitioners, and we're seeing this even with the patients that are coming and paying cash to see us, they're either desperate or they're financially well off. They can afford to have that discretionary income go towards their health care. But for the majority of the patients, they want to use their insurance. They have their insurance and they want to use their insurance. So by setting up an insurance-based integrated medicine program, I think we've been more successful financially because we've been using that model.